Good morning, Janice. How are you doing today?
I'm fine. How are you?
I'm good. I'm Susan with Respiratory. I'm going to do some checks on you, and I'm going to put a BiPAP on you today, okay?
Okay.
This should help with your breathing a little bit, all right? My name is Susan Gray. I am a respiratory therapist, and I work at Clarinda Regional Health Center. Clarinda Regional Health Center is a critical access hospital, which means we're serving a small rural community. The patients that we see have limited access to larger facilities. Some of the challenges our patients have are transportation, distance from home to healthcare provider. Providing these services here make it much more accessible to them to get the healthcare that they need. I got into respiratory therapy because I knew I wanted to go into some sort of healthcare. I wasn't sure what I wanted to do. I was a kid that had asthma and an athlete and kind of had some experience as a kid with some respiratory therapists and thought it was pretty cool. And I knew that I wanted a job that was going to be secure and flexible with what I wanted to do in life. A typical day is I get here, I open my computer, check to see what kind of patients we have that are on the floor and patients. Gather their medications. I also look at my schedule for the day for my outpatients. I go down to the floor, see the patients, converse with the nurses about what's going on with those patients. Come back, get set up for any sort of outpatient test I might do, including pulmonary function testing, home sleep studies, stress testing, get that all set up. I'm also answering the phone constantly because we are on call for the ER. We go to traumas, we go to anything that they might need help with breathing issues. We do arterial blood gases to see how people's blood is transporting the oxygen in their blood. We do BiPAPs, CPAPs, life supports. Conditions we most often deal with are COPD, asthma exacerbations, pulmonary edema, lung cancer, chest trauma from accidents. The most rewarding part of the job is the continuation of care with patients and seeing them improve over time. A lot of times they come to me when they're at their worst and we do a pulmonary function test, and then they go on to do treatments, pulmonary rehab, have their surgeries or do their chemo, and they come back to me and things are improved, and it's nice to see that what we're doing is helping.